Hi, everyone. We will get started at 1:30. Hi, Katie. Welcome. We'll go ahead and start at 1:30.
Hi, Melissa. Glad I could be here today.
I'm so happy that you get to be here today.
April the 10th, that's the
All right, we'll go ahead and get started. Good afternoon, everybody. Thank you for taking the time to attend our monthly behavioral health provider listening session. My name is Melissa Temke. I'm the HCA Behavioral Health Communications Manager. I will just take us through some of these intro slides today. If you are not speaking, please mute yourself. You can go ahead and ask questions throughout the call. There will also be time at the end of the call for questions. And if we can't answer your question, we will do every attempt to follow up after the call so that hopefully we can answer your question then. Today, we're going to have our new DBHR Director, Tisha Kirschbaum, do the welcome. And then Michael Langer will take us through section updates. Rebecca Ruiz will go through results of the Healthy Youth Survey, and Sandy Silvarez will go through the Young Adult Health Survey. Then Tina Burrell will talk to us about the Olympic Heritage Project, and we'll have time for questions. So a lot of great information. You can find a link to the slides in the chat, and we'll go ahead. Tisha, take it away.
Hi, good afternoon, everyone. So excited to be here. Thank you, Melissa, for the warm welcome and introduction. For any of you that I haven't met, my name is Tisha Kirschbaum, and as of April 1st, I became the new director here at the Division of Behavioral Health and Recovery. While I'm new to this role, I'm not new to the division. Thank you for the clapping hands. For about the past year and a half, I had been the one of two deputy directors. Michael Langer was the other deputy director, and I was overseeing treatment and recovery programs. So with my promotion into the director role, they left a gap here within the agency. So we were lucky enough that Teresa Claycamp agreed to move into an acting position as our new Deputy Director of Treatment and Recovery Programs. So we're very excited to welcome Teresa to that role. This is an acting position, and we will be posting that position as part of a competitive hiring process here, hopefully, maybe at the end of this week, hopefully by the beginning of next week, but soon. So just know that that position will be posted shortly. So I wanted to give a couple of those just updates about some of the changes that are happening around here at DBHR. Enough about all of that. I want to hand this off to Michael and the prevention team and to Tina to give the updates and share this information with you. And of course, the most important bit at the end when we get to answer any of the questions that you guys might have for us. So welcome. We always look forward to this opportunity to share information and to hear from all of you. And on that note, I'll hand it over to Michael. Thank you.
Thank you, Tisha, and congratulations again, Director Kirschbaum. I'm glad to have you on today and leading us off. And for the rest of you, I've had the opportunity to meet many of you, but not all. So I'm Michael Langer, one of the two deputies here at DBHR. And I will go through our slide deck this morning in terms of section updates, and then we'll get on to the featured presentation. So leading us off, we do have a couple of announcements from our prevention section. First of all, the Prevention Summit that has been happening in one way or another since the mid-1980s, believe it or not, is happening October 29th and 30th in 2024. And I believe this year it's going to be over in Spokane, or maybe somebody in the prevention section can correct me about where that's being located at. I think we were over there last year. And then the Spring Youth Forum is coming up sooner than that, and that's here in Grand Mound or Rochester, Washington, South Thurston County at the Great Wolf Lodge, and that's on May 8th. And all those youngsters have been working on the youth team activities all year long, get to come and showcase some of that work that they've been doing. So I'm really excited to have those two opportunities. Next. Okay, in our prenatal to 25 section, they're recognizing and preparing for May as Mental Health Month, and there is a comprehensive mental health toolkit that's been put together. Leading some of that work has come out of the P25 work along with our communications division, and the toolkit provides resources and strategies to enhance mental health and build supportive communities. There is a website that you can go on and link on. It has a lot of the resources on there. I'm sure that they would take feedback as well if you think if there's things that could be added in future years. Really want to raise awareness and have resources in the hands of communities. So really give a lot of credit and thanks to our P25 group. Next slide. All right, many of you have been hearing about the ASAM criteria update, and we know we're going to the 4th edition. And while that sounds simple enough, going from the 3rd to 4th edition, if you've had a chance to look at it at all, you'll recognize that there's quite a few changes being made. And so we want to be mindful of those changes, a little bit strategic on how we roll out and adopt 4.0, and making sure we have sufficient training available for those that contract for our services and those that are actually providing the services. And so we will begin a flight or mini flights of training this spring. And while we're not in a position to announce the dates quite yet, they will be out shortly. So we'll be sending those out through our Gov listservs that you're all receiving your messages from. And I'm sure we'll be talking about it in future monthly all provider meetings as well. Next slide. All right, for our substance use, adult substance use section, we have a couple of announcements in terms of some opportunities. There is the Transforming Our Communities, together with Compassion, a gathering of supportive strategies for drug user health. And this is being put together by the University of Washington and is on May 16th. And you can see here that there's a contact, and it's pretty much all day on the 16th, and they've done this for a few years now. And then also on September 26th through 27th is the 5th annual Reimagining Behavioral Health, Race, Equity, and Social Justice. And we began these during the pandemic, as I recall, and BHI got stood up, and we talked about, types of training that we could put together for the field, and they've continued to roll these out each year after that. So it looks like we got proposals open until May 10th, and then there's some contact if you want more information through the BHI as well. So thank you for bringing that forward. And next slide. Mental health, adult mental health services and involuntary treatment, House Bill 1134, which relates to 988 behavioral health crisis response and suicide prevention, from the 23 section requires HCA to develop endorsement standards for mobile rapid response and community-based crisis teams. Late February, we started the rulemaking process that will establish these endorsements, and we have almost completed the rule drafting process, and we'll provide an update when the draft rule is available for public review and comment. So that's just a little teaser that this work is kicking off or has kicked off, and we will continue to provide an opportunity or provide updates so that you'll have an opportunity to provide feedback. And I know that's not all that comfortable watching somebody read to you, but I wanted to make sure I got all the specifics there for that update. Next slide. Okay, in addition to that update, this team also put forward some updates related to PACT, the Program for Assertive Community Treatment. In the 24 supplemental budget, there are new PACT teams for 25 in Clark and Thurston County. There's also bridge funding to assist providers in fulfilling utilization requirements per the proviso. There will be a rate increase that's happening as well, and a little different way of the funding being put out to the teams. And there are some direct conversations happening between the section, the adult treatment section, and the providers of PAC. So I won't get too much into that, but there are some changes in how the formula is ran. The University of Washington Spirit Lab also has some funding for technical assistance, and funding was provided to HCA to contract for an assessment of access for young adults in PAC services. So certainly that's an important feature to be looking at. And then we did get some one additional FTE as well. So next slide. Recovery support services. We got a few announcements here. We've got the 40-hour crisis awareness and communication and peer support training, which is required for certified peers working in crisis settings. Registration is open for seats in that training, and you can reach out to Amanda Pauley for registration information. The Washington Peer Network is an online resource for employed peer counselors. And again, you can go here to register to get more information about the peer network. And then the Peer Pathways Conference is scheduled August 21st and 22nd in Yakima. The registration will be sent out this spring. We don't have the details of that quite yet, but when we do, we will go ahead and get that out. If you want to put a hold on your calendars for the 21st and 22nd, if you're interested in the Peer Pathway Conference, those have always been received very well. Next slide. All right, I think I'm going to turn it over to our prevention colleagues. And again, if there's any questions about any of the announcements, we can go ahead and take those at the end of the call here. And Rebecca, are you going to go ahead and go first? I see you came on screen.
Yes, I'll be going first. Thank you, Michael.
Okay, you guys are in for a treat here now. I'm going to turn it over to Rebecca. Thank you, Rebecca.
Thank you, Michael. Hello, everyone. Good afternoon. I'm Rebecca, and I'm part of HCA's SUD Prevention and Mental Health Promotion section and part of the HYS team. Today, I'll be sharing this Healthy Youth Survey, survey methods and interpretation, provide an overview of results, and share some data products available on the HYS website. Next slide, please. Thank you. I think you have to click a few more. I forgot to take out the animation part of this. I apologize. And so the Healthy Youth Survey has been implemented since 1888 and became officially the Healthy Youth Survey in 2002. It's a statewide agency partnership with DOH, OSPI, and LCB. And the purpose of the HYS study is to identify trends and patterns in adolescent health behaviors, identify areas of need to inform policy and practice, as well as evaluate the impact of school and community prevention efforts, and provide data for grants and other funding sources. Questions from the survey are from other national surveys, skills, and questions proposed by partners. It's implemented every other year, and since the pandemic has shifted from even years to odd years, and it's for students in grades 6 through 12, and it's administered in a school setting. Next slide. Thank you. Here we're looking at a chart of participation over the past 3 cycles. And then in the last row or last column, we can see participation rates in 2023. There was 217,546 students who participated in the survey, with 61% of students enrolled in public schools. The majority were students in public schools with 864, followed by private and charter schools of 5 schools in that category, and 4 tribal schools that registered and participated in this survey. 39 districts or all counties participated in the survey, as well as all ESDs. Thank you. And so the survey methods for this service cycle in 2023 is that we fully implemented the survey online using the Qualtrics platform. And so we did not accept or take or administer any paper and pencil surveys. This allowed to reduce the burden of surveying with the skip pattern logic that was in place. And so it asked students a gate question and a follow-up question if that applied. If it did not apply, the next question was then asked. It also allowed for randomization of the survey questions and no drop off at the end of the survey, as it was typically seen with the paper and pencil survey. We do have an elementary and secondary form, and we no longer have the forms A and B. We also had processes in place for remote options in the alternative learning experience for students who are in ALE's programs. And there was no exception process as well for the sexual orientation or the gender identity questions. There was an opt-in process for sixth graders or the elementary survey form asking if they wanted to opt in to ask this question. And the response options were varied from the secondary survey form. And that response
Rebecca, somehow you're muted. I don't know what happened.
Okay, I am
That's better.
unmuted. Yeah, okay.
You're great. You're great.
How far
Thank you.
have I been muted for? Let me. How far do I have to go back?
maybe just maybe go quickly over the opt-in process for sixth graders. That's about where you cut off.
Okay, yeah. So so for the sixth graders or the elementary survey form, there was an opt-in process where schools were able and school districts were able to opt into the question of the sexual orientation, gender identity questions. The response option was different in that it offered the boy, girl, female, girl question, and then our response options as well as or something else fits better. So that was a difference from the elementary to the secondary. And there was also an exemption process for sexual behavior and sexual violence questions. So schools were able to decide if they wanted to participate in those specific topic questions. One thing that we do know about our Healthy Youth Survey is that we test for reliability and validity throughout the process. We can answer that the questions and the responses are consistent, and it answers the question, are students telling the truth? Many times we do hear in the community where they may be second guessing some of the students' responses, but we can say that our survey is reliable. The results track with national data, as well as our survey is valid and it provides accuracy to the questions being asked. Can we trust the results? And we sure can. We have a high quality control process and procedures in place and quality assurance throughout the whole service cycle to ensure that we are getting the most valid responses from the students. And those procedures are detailed and outlined on our Ask HYS reports and manuals that can be found. I can show you where they're at and later through this presentation. And so with after the pandemic, we are using caution of interpreting trends. And this is due to the shift in methods as well as the pandemic and the shift in cohort of students. And so as I mentioned earlier, the survey was conducted on even years and now has shifted to odd years, which is a new cohort of students that we are surveying on. And so that calls for caution, as well as the data from 2023 is beginning to provide a little bit more of understanding of adolescent health during and after the height of the pandemic. And 2025 will really provide us more of a clear answer. So please use caution as we interpret those trend lines. Next slide, please. So now we're going to go into the details of the results. This is among 10th graders who reported substance use. It's still at 50% lower than pre-pandemic levels. Past 30-day use of substance for alcohol, marijuana, vaping, and cigarettes had no significant change from 2021 to 2023. Marijuana is inclusive of any product with the amount of THC, I apologize, or any dried herbs, edibles, oils, dabs, marijuana drinks, or other products. It's not inclusive of only CBD oil products. And the term marijuana is used as that's the preferred term by youth, and youth did participate in providing feedback during our focus group sessions. And so that's the term that we used during 2023. results, comparable were lower than the Monitoring the Future survey. Here we see a screenshot of our Healthy Youth survey data dashboard. It's newer to our website, and we can select on the left side, select the year of a data or a survey cycle by grade. You can also select county or ASD level, region or location. And in the works, we're going to have a filter on rural or urban, and so we can differentiate some of those data points, as well as select a topic and all the variable measures here. And each trend view, we're going to see in green the state sample compared to the region or location that was selected. And on the upper right-hand side, where we can see the different views of data. And right now we're looking at the trend view. There's also a breakout view available, a map view, and a data view. Next slide. So as mentioned, substance use remains 50% lower than pre-pandemic levels. This is good news. Lifetime use of alcohol has increased from 2021 to 2023, as well as past day substance use for other illegal drugs, painkillers, prescription drugs increased from 2021 to 2023. This number is still low, while there is a significantly increase in use of past day 30-day use. In these substances, it's still below 3%. In this topic here, we are higher. Washington State is higher than national results from Monitor the Future in grade 12. And perception of harm from prescription drugs decreased from 2021 to 2021. Next slide, please. Okay, I think we skipped the slide on the specifics of percentages of new substances that were asked, but it was just a breakdown, which is fine. Here we see, it's okay. Here we see a trend line or a trend view of feeling sad, hopeless, and suicide from 2012 all the way to 2023. In blue, we see feeling sad or hopeless, and in purple are adults to turn to when sad or hopeless. In green, it's considered attempted suicide, and in orange, attempted suicide. And we'll see the break, that point and break of the trend line, and here we see the two past cycles. Over half, so over 62% reported feeling anxious. That's around 55,000 students. 30% reported feeling depressive. That's around 27,000 students. 15% considered suicide. 12% planned suicide, and 7% of 10th graders attempted suicide, and that's around 6,200 students. Next slide. Yeah, it's okay. That one was supposed to be before the mental health slide. Not sure how it got there. Yeah, hope skill, thank you. There's no significant change in hope from 2021 to 2023, which is a slight decline from the pre-pandemic levels. And then computed from our 4 questions about agency, ability, and pathways, there was 8% of no or very little hope, followed by 21% of slightly hopeful. Moderately hopeful was 28%, and highly hopeful was 43%. In combination, 71% of students reported moderately or highly hopeful about the future. Here we see a breakdown of demographics compared to feeling sad or hopeless, and we can see the various demographic types and categories, and where we see more of the disparities are students who identified as sexually within the sexual orientation or gender diverse, and disabilities. So SOGI, having a sexual identity or other heterosexual, or having a gender identity other female and male, have higher disparities with feeling sad or hopeless. There are more than 2 times the feeling anxious, nervous in the past 2 weeks compared to other students, as well as 2 times more feeling sad or hopeless for 2 weeks or more in the past year, 2 times more having no or very little hope, and 3.5 times more complementing suicide, 3.7 times more planning suicide, and 2.6 times more attempting suicide. And disparities continue in students who identified as having 1 or more disabilities compared to students who or youth who are without disabilities. Students who have 1 or more disabilities have 2 times higher of no or little hope, and nearly 3 times higher feeling sad or hopeless within the past 2 weeks, and 4 times higher considering suicide. Some of the questions to identify students if they had 1 or more disabilities consist of the question of, do you have any of these conditions? And some of the conditions are there as response options include developmental or intellectual disability, learning disabilities, mental health conditions, mobility disabilities, sensory disabilities, deaf, blind, or other health conditions. We also asked about gambling, and in 2021 was our first time we started asking about gambling and problem gambling. We saw no significant decrease in gambling from 2021 to 2023. There was significant increase in problem gambling. In the past 12 months, students were asked if your gambling has ever caused you problems at home, school, or with your friends. Here is the breakdown of the response among 10th graders, and we see that around 10% of students reported they had gambled in the past year. And the focus should not be on the problematic, should not be on the initiation of this problematic activity. And then it's, but the fact that they're initiated with this activity. Next slide. Disordered eating is a new topic in our survey. We asked disordered eating questions in all grades. We see that 50% of students said they were shamed by a friend or family member about their body. 58% reported at least 1 disordered eating behavior, such as taking diet pills or laxatives, vomiting, or fasting to lose weight. And the likelihood of reporting disordered eating behaviors increased as the students reported more frequent body shaming by the people in their lives. Handguns, accessibility to handguns is also a question on the survey. In this survey cycle, we saw that perceived access to handguns decreased. So in 56% of 10th graders felt it would be very hard to get a handgun if they wanted one, compared to 71% in 2021. Perception does not necessarily equal actual access. However, among 10th graders who seriously considered attempting suicide, 11% said they would easily access a handgun compared to 5% who did not consider suicide. Also, 13% of youth with 4 or more ACEs reported very easy access to a handgun compared to 4% with no ACEs. And those with no or very low hope were more than 2 times as likely as youth with higher levels of hope to report very easy access to firearms. And so here we have a significant increase in social support. We do see that students reported having an adult to turn to when feeling depressed, as well as having people to turn to from school when they needed help, and receiving information on mental health and social support from their school, especially in particular to warning signs of suicide. So from this, we can see that schools, families, and communities programs are doing a very important job and doing a great job in providing this information to students. Some of the key takeaways are that emphasis on student resiliency and finding hope, health indicators trending in a positive direction. Substance abuse has mostly remained steady. Substance use, pardon me, has remained steady, and mental health trends continue in the right direction, but disparities still remain. We can't pull back on the momentum of the work, the great job that everyone's doing now in all the social the environments that youth are involved in. And so together we're making a change. You can access our results of different topics and variables at askhys.net, survey results, or just askhys.net on our dashboard, and you'll find various products like frequency reports, fact sheets, using the amazing tool of Q by Q analysis, and you can cross-tabulate various variables from our survey question, as well as other reports that can help analyze the methods and interpret results. Next slide. Here's an example of our fact sheet. Every fact sheet will have a background page, a resource page, as well as some graphs and some demographics. I'm kind of going a little bit faster. Sorry. I think you have to click 2 times more and then it gets the next one. Yep, there we go. So that's what a fact sheet will look like. And for any topic that's available. Next slide. Here is our Q by Q analysis, again, where you can cross-tabulate any variables. It's a drag and drop feature, so it makes it easy to maneuver and use. Next slide. The dashboard, again, can be seen in different views: trend view, breakout view, map view, and data view. And on the left side, you have different filters and layers to apply for the data, as well as a display of the questions that are being tabulated. Next slide. Here we also we have data resources, as I mentioned, an interpretive guide, and analyses, and just more information to help with some of that, going deeper into the data. Next slide. And we are currently starting our HYS 2025 cycle, where we've been receiving revision feedback and new question proposals for the upcoming survey. And we'll be, again, involving youth in our survey process to meet the youth needs, as well as ensuring that we are speaking the same language on the survey forms. And our next feedback would be on the Spring Youth Forum on May 8th. And we have a big partner revision meeting May 22nd and May 30th, where everyone is welcome to come and listen to our revisions that we have gathered throughout the past 2 months for the new cycle. Thank you.
Thank you, Rebecca. That was awesome information. I'm going to go ahead and let Sandy talk. We're a little bit, we have 26 minutes left in the call, but we're really excited to hear the results of the Young Adult Health Survey. So welcome, Sandy.
Hey, how much time are you going to give me so I can stay on track?
Can you do it in 15 minutes?
15? Okay, so about 2:20. Okay, great. Okay, hi everyone. My name is Sandy Salveras. I'm a Prevention Research and Evaluation Manager at the Department of Behavioral Health and Recovery at HCA. I manage and coordinate a number of data projects that our unit oversees. So next slide. We'll go forward. Okay, next one. Okay, so this is a quick overview of the Young Adult Health Survey. The Washington State Young Adult Health Survey measures cannabis and other substance use, perceptions of, that should be harm, sorry, risk factors and consequences among young adults age 18 to 25 that live in Washington State. The survey was motivated by the passage of Initiative 502 in 2012. That's when at the time the survey began in 2014, was before recreational cannabis stores opened their doors. And the primary statutes for cannabis are codified in RCW 6950. The revised code implements rules for cannabis statutes, as well as authorizing the use of revenue from the dedicated cannabis account to pay for the Young Adult Health Survey, as well as the Healthy Youth Survey. Next slide. I just wanted to point out that you went forward too much. So can you go back one, please? Yeah, right here, thanks. So I just wanted to point out that the principal investigator of this survey is Jason Kilmer. He is an associate professor in psychiatry and behavioral sciences at the University of Washington, and he serves as an investigator on several studies evaluating prevention and intervention efforts for alcohol, marijuana, and other drug use by college students. So us here at HCA, at DBHR, we are the sponsors and we manage the contract for the survey. So each year we collect data from a new cohort of 18 to 25-year-olds. Participants are recruited using a combination of direct mail advertising to a random sample from the Department of Licensing, as well as online advertising through Facebook, Craigslist, Instagram, and through the survey study website. I'll mention that this is a convenience sample. It is not a random sample. We get them where we can find them. And to improve our results, we use post-stratification weights based on sex, race, and geographic region. And I also want to point out that the weighted results are consistently very similar to non-weighted results. Next slide. Let's go to the next one. So as I said, the survey began in 2014, and during that year, we had 2,101 respondents. And as you continue to go down through the cohorts or the years, these were all the number of respondents that had responded to the survey each year. Next slide. Next slide. Okay, so now we're going to talk about some data. I will focus mainly on the marijuana data. There's tons of data that we can look at, but we will focus basically on marijuana. So, and we will look at what has been going on in the last 10 years. So I know there is a lot of data here, a lot to look at, but I'll tell you where to focus. So what you're seeing here is this is the response to the questions of have you used recreational cannabis in the past year? And if you look at the bottom for cohort 1, back in 2014, 43.5% of respondents said they used cannabis in the last year. And then you can see with every other year that the survey has what that rate was. And in the green circles, that tells us that that cohort has been significantly higher compared to cohort 1. And this is looking at young adults in general from ages 18 to 25. We do stratify these rates by age group from 18 to 20 because they're not able to go into a cannabis store and legally purchase cannabis. And then 21 to 25-year-olds obviously are eligible to go into the store and purchase their own cannabis. Next slide. Okay, so what I want you to focus on here, this is for all young adults aged 18 to 25. The rates for each year, and the trend over the last 10 years is that using recreational cannabis in the past year has increased significantly. And this is actually being driven by those 21 to 25. So we'll go to the next slide. As you can see here, that it is significant. It has gone from 43.6% in 2014 to 51.9%. And with the 18 to 20-year-olds, there has been no significant trend. It's basically remained the same. Next slide. This is just showing you a graph of the trend for both the age groups. You can just see it visually. Next slide. So now here, so the last couple of slides, we looked at use during the last year. This is monthly cannabis use. And as a whole, you can see that the use of cannabis monthly has increased, and it has been significant in cohorts or years 2018 to 2022. Next slide. And so just like focusing on the bottom, all the rates, it has been significant. It has been driven by those ages 21 to 25. Next slide. And with 18 to 20-year-olds, there hasn't been any significant changes. So next slide. And here is a graph where you can see it visually. Next slide. Okay, so there's a lot of numbers here. And what I want you to focus on here is that, so this is a question when we ask like how frequently they're using cannabis. And you can see in the far left column, they can respond never, once a year, 2 to 3 times a year, all the way down to every day. And we just wanted to point out that in cohort 10, which is the most recent cohort, is that daily use is higher than at any time. So at 10.39% of respondents are saying that they're using cannabis every day. Next slide. And I think some stuff disappeared from this slide. This is actually perceived norms of non-medical cannabis use. And what I want you to focus on here is that so these are, okay, I think there's something missing on this slide. Can you go to the next slide? Yeah, there you go. Okay, keep going. Okay, can you go back? Okay, so what? Yeah, the bold on the bottom. Okay, so as we can see on the past slide that 20.8% of respondents are saying that they use at least weekly. But yet when we look at this chart and we look at how others are perceiving, how their peers are using, they 69% think that their peers are using weekly. So the perception of use is a lot higher than what is actually happening out there. Next slide. This is a question we asked on the survey, how young adults get cannabis and how they got it in the past 30 days. And as you can see, there is a variety of ways that they could get it. And let's see what the results show us. So next slide. Okay, so what I want you to focus on here, and this is for 18 to 20-year-olds. They're not, you know, legally able to go to the store and buy marijuana, but we're seeing significantly increasing trends in that they're giving money to someone to purchase it for them. What is kind of really alarming is that they're getting it from parents with permission. It went up from like 6% or 5.75% to 15.77% in 2023. And then just a small portion are saying that they're stealing it from a cannabis store. And this is for 18 to 20-year-olds. So next slide. And for 21 to 25-year-olds, obviously before cannabis stores opened, 8.8% were getting it from a retail store, and that has gone up to 72.3%. Okay, thanks. So perceived risk, since 2014, there's been substantial declines in the perceived physical risks of occasional cannabis use, as well as in perceived psychological, emotional risks of occasional cannabis use. There's been significant increase in perceived risks with alcohol, drinking alcohol 2 drinks every day, or the psychological risk of drinking alcohol twice a day. So as you can see, the risk of drinking alcohol is increasing, but they do not think that the risk of using cannabis is harmful. So next slide. And just a quick review of other substances, we are seeing a decreasing trend in use of alcohol in the past year or in the past month, as well as using cigarettes in the past year, or using pain relievers to get high, or using heroin. That's all been decreasing. So next slide. Okay, just keep going one more. Sorry, I wasn't expecting this to go like this. Okay, so we are going to be implementing the survey again this year in 2024. It will be our 11th year of data collection. The Young Adult Health Survey team at UW, they've also secured extra funding from the Department of Health, which will allow them to collect data from previous respondents that to see the responses as they're aging out of young adulthood. We are also adding in some new items for fentanyl use, as well as the potency and concentration of the products used, as well as Delta 8 and Delta 10 products. And there's one more on the bottom, if you can just move forward. And there's a number of mental health items that will be added onto the survey as well. Yeah, okay, so that's it. If you have any questions, feel free to email me. You can also email Jason Kilmer at UW, the principal investigator of this survey. We do have frequency reports, and we are going to be submitting them out soon. And if you want a copy of the report, just send me an email.
Awesome. Thank you so much, Sandy. Thank you so much. That's great. Okay, we have Tina, who's going to share with us about Olympic Heritage Behavioral Health. Welcome, Tina.
Thank you. Good afternoon. Again, my name is Tina Burrell with the Division of Behavioral Health and Recovery, and currently I'm working to help launch this new project, Olympic Heritage Project, sometimes called the 40-Bed Project. This is an opportunity. I think we're missing the first slide. Can you go back one? Well, I will.
Yeah, sorry.
All right, well, let's go with it. Under Proviso 130 from our last session, HCA was directed to launch services at a facility called Olympic Heritage Behavioral Health. And this is a facility that's located in Tukwila, Washington. It's a facility that was recently purchased by Department of Social and Health Services, and they are operating 72 beds, and they started providing services in the fall of 2023. So in addition to those 72 beds, we have 40 beds that we have an opportunity to provide community behavioral health services. And the first step to do to launch that work is to provide a survey to find out for providers who are interested in these services and help us determine which services should be selected. And you'll see on the screen that we plan to issue it from May 1st through May 6th. And I think we've landed on issuing the survey on May 3rd. The next step from that survey is to provide the results to the Office of Financial Management and legislative committees, and then also consult with DSHS. So the proviso wants us to do this provider interest survey, but we've also decided that we are going to go broader and receive information not only from providers interested, but feedback from stakeholders, individuals with lived experiences, from tribal governments on what services should be provided in this facility. So again, we're going to receive this information, we're going to share the results, we're going to consult with DSHS, and then Healthcare Authority is going to provide a recommendation to the Office of Financial Management for their approval. So once we go through all of those steps, we will have determined what services to procure for this facility. And the target date is the target date for the RFP is August 1st, and to launch the services is April 1st of 2025. Next slide. Okay, so this was the intro one, so they got a little mixed. So we're going to contract for the services. The facility is in Tukwila. It's providing 40 beds. And the primary focus for these services are individuals who are involved with the legal system or a likelihood of involvement. So we want to have the behavioral health supports in the right setting. And that's what this facility and these beds are to do. And again, April 1st is the date. The funding for this for 2025 is $3.5 million, and the RFP will be for 5 years. Next slide. The proviso calls out specific service types. These are a guideline. When we get to the survey part, you can also add in other services. But we're looking for folks who are interested in providing short-term services, residential care, thinking about how we link our crisis services or 23-hour crisis services, perhaps to this short-term stay in this facility. Again, we're looking for residential, transitional, and supportive services to divert individuals from the criminal legal system or emergency departments. And of course, we want to consider substance use or co-occurring treatment. This could be an outpatient model or an inpatient model. We want to include programs designed for treatment of opioid use disorder, and then also supportive and residential services for individuals and outpatient competency restoration. So these are the guidelines for services to select from, and we want stakeholders, our providers, others to think about what services, what's needed in this facility. Next slide. The survey will be going out. Again, launch date May 1st to the 6th. We do think it's going out on the 3rd. The survey will be open for 2 weeks. And we are sending it out on Gov delivery lists. We're going to send it out to our managed care organizations, our partners over at the BHASOs, and also the listserv for the Office of Community Voices of Empowerment. So we want a robust response for what services are needed. And we also want to hear from our tribal governments. They will receive this survey. We also have been invited by the American Indian Health Commission to participate in a meeting and receive responses from them. So we'll have a wonderful, hopefully high response rate and information for Healthcare Authority to review and determine a recommendation for the Office of Financial Management so we can move forward with procuring these services. That's my overview. Thank you.
Fabulous, Tina. That's really great information. Thank you so much. So we have reached the end of our slides. This is a great time. We have 4 minutes left in the call. If anybody has questions, you can raise your hand, you can shout it out, you can write it in the chat. But go ahead. Yeah, I see Courage to Change. Angie. Go ahead.
Can I ask a clarification question?
Yeah.
So clarification question, you guys are going to start offering trainings on the ASAM that's coming out. Is that what you guys said?
That is a great question, Michael.
Yeah.
Or Tisha, do you have an answer to that?
Yeah, this is if Amy Dura is on. Amy, do you want to address this? But I know Teresa Claycamp is not in today, and Amy and others have been working on this. And we will be having several flights of training coming out, Angie.
Hi, Michael. It's Gail.
Yeah, go for it.
Hi. Yeah, our ASAM training should be starting mid-May.
Okay.
Is when our first classes should be coming out. We have several classes that'll be going throughout the rest of this year and into next year. And there'll be a 4-hour short session for those who are like administrators or somebody who just needs a brief overview of the changes. And then there's going to be some longer trainings. There's one that's like 5 sessions long. So, I mean, there's a lot of detail that's going into these. Train for Change will be putting them on, and you guys should be getting notices soon.
Okay, thank you for the information. One other clarification question. This is still Angie at Courage to Change. Is it, does it look like January of 2026 now that we are going to shoot for Washington State to have this up and running? Is that what I saw too? I got on late, I apologize.
Oh.
Yeah, this is Amy Dura. That's correct.
Okay. Yay. Perfect. Time to change everything.
Awesome. Love it.
Thank you.
Okay, any other questions? Questions for each other, questions about Healthy Youth Survey. We threw a ton of information out at you today. There are links to the slides in the chat. Feel free also to reach out to anybody on this call after if you have any follow-up questions. I'm just going to give a little pause, put myself on mute because I am okay. I don't see anything. I don't see any additional questions in the chat. I appreciate your time and your attention and all of the things that you bring to these calls. And please reach out if you have any additional questions. We appreciate you. Tisha or Michael, do you want to add anything before we sign off?
No, just thank you. And we look forward to connecting with all of you next time.
Yeah.
Yes. Again,
thanks.
Appreciate you being the hour. Take care, everybody.
Thanks. Bye.